Nurses. Despite being ranked the most trusted profession for 15 years in a row, what are the dirty secrets you'll never tell your patients? Story 1. I work at a New York City ER. I'm not joking at all when I say the nurse-to-patient ratios are usually 1 to 18, up to 1 to 30 on very bad nights. I am literally the only person to take care of all of these people, their extensive families and field complaints and true medical emergencies, especially because my techs are off in the back texting or hiding away or get pulled to do constant observations of high-risk patients. I have varying degrees of sick patients, but I find the ones that are most stable are the biggest complainers who threaten to leave the hospital. I tell them they're free to leave at any time. Also, I've had people who complain of 10 out of 10 pain, walking around and talking on their phone and laughing. They follow me around. Pain medications cannot be given earlier just because you follow me around. I once had a sickle cell patient tell me that the patient I'm working on at the moment is already passed away, so I better give her pain medications. I told her she better leave. The curtains between beds, I don't even know the definition of the words private room when it comes to a hospital, are not good for privacy. Isolation patients are sometimes right next to another patient because we're so full. If I'm running around, a person needing a bedpan or water is the least of my concerns. I work trauma bay very frequently, and family members get in the way, to a point where they impede their loved one's care. There's probably tons more that I can't remember right now. I think everyone wants to see someone that they love not be in pain. I can understand that some people complain, and there are some, rightly so, that they need some care, but they're not getting it. And I don't think that's completely the nurse's fault, especially with nurse-to-patient ratios like that. Story 2. Sister is a nurse who has had surgery for a torn rotator cuff 3 times, fusion on her cervical vertebrae, and more sprains and pulls on her lower back than I can count. She is in freakishly good shape, but lifting, turning, and assisting obese patients is crippling her. Fat is shifty and unpredictable when a patient is in pain and or under the influence of pain meds. I was visiting when an obese friend was recovering from gallbladder surgery and watched as he swung one tree trunk-sized leg over the side of the bed to stand up, and the rest of his bulk followed like a mudslide. Sis ran over and caught him and rolled the whole sleepy beast back onto the bed. A bad fall could have really set back his recovery. I heard a bone-crunching sound as her back bent under the weight. Her big secret is that she has been ordered to get the lift, an awkward and bulky sling/crane, for any patient over a certain BMI to avoid further injuries. Most of her patients complain that she's deliberately humiliating them by hauling out the crane each time they must be walked or the linens changed. But there is no safe way for most healthcare workers to habitually muscle around obese patients. Too long didn't read? The sling isn't there to shame obese patients. It's there to help healthcare workers avoid crippling injuries to staff and patients. If you're in pain, you are in pain. Focusing on yourself and your pain, yes, I can understand that. But this is not something where you're complaining about a retail store worker who's probably just standing there in some capacity. There's someone who is assisting you and who's physically getting you around. I can see both sides of this one too, but yeah, I think it's great that there is a device helping more obese patients actually get around for the safety of everybody. Story 3. My mother has been a nurse for 25 years and has always worked hard. It breaks my heart that she often doesn't take a break even to eat during her 12-hour shifts because she doesn't have time. Her hospital is understaffed and overstressed, and she's the floor manager. I'm not sure if that is the correct title, and must help out the new nurses in addition to doing all her own work. She must also find a replacement if a nurse calls in sick. She does not get paid a higher salary for doing this extra work. It doesn't help that she struggles to keep up with her new charting systems. I know she's not technologically savvy, and I worry for her. She often came home an hour after her shift ended because she had to finish stuff up. She does it off the clock, but has been written up for being too slow with it. She is so exhausted mentally and physically all the time. I just wish as she grows older she could have a cushier job experience. The stories of incompetence, indifference, and neglect of both patients and the nursing staff that I hear just make me sad. And most are caused by administration decisions and budget cuts. The nurses are the ones who get botched over the most. Be kind to them. With all the talks of strikes going on, I'm trying to think in my mind if there's any healthcare strike going on or in the future. I think there have been a few nurse strikes going on, and it's stuff like this that just brings about quite a lot of support for nurses if they do. Story 4. For the last few years, it's more important to make patients happy instead of using our skills and knowledge to help make you feel better. This is dangerous. Our job is to heal, H-E-A-L, not to heal, H-E-E-L. We have way more patients than just you. That means while you're pushing your call button for the 100th time wanting something menial, we have other patients actively passing away. We hate that we can't answer in a timely fashion, but we have to prioritize. I'll run to the patient that is coding before I'll take you your 10th pack of graham crackers. Also, we aren't being mean when we make you take part in your own health care. If you're an illicit pharmaceutical seeker, we fill your IV with saline when you think it's morphine just to watch you be stupid and act like you're high when you really aren't. We're tired. We're overworked. We have constant changes and new rules. We're overwhelmed. Just be patient and be understanding. There's a whole lot more going on than you can ever see. Also, end-of-life care. If you're actively passing away, usually there's an order for morphine and Ativan that we use to calm your respirations and ease your pain. Almost every nurse I know has given it as often as possible to help you ease into passing. This isn't especially a bad thing. Story 5. In many areas of the U.S., thanks to brutal cost-cutting measures, chances are your nurses on some level are worried about hurting or having a patient injured/neglected, etc., for simple lack of time. They have to check orders, safely give medications, provide other treatments like wound care, admit and discharge patients, make sure tests and other exams get done, bathe, feed, ambulate patients, monitor and assess your condition, and communicate with you, your family, your doctors, your CNAs, and all the other tasks to get done. Then do endless charting on each and everything for between 4 to 7, or hell, more if someone called off or your facility sucks, patients on a med/surge floor. Lots of times they barely have a chance to pee, grab a snack, much less a meal, or an actual break. This is over a 12-plus hour shift. Even with the CNAs and other ancillary staff, there's just not enough time in the day. The CNAs are just as understaffed as the RNs, but they risk getting written up because a patient whined that it took 15 minutes to get fresh ice water. Story 6. If you and your family are nice to me, I will go above and beyond to make sure that you're comfortable, and I will do whatever extra I can to help you. However, if you're rude to me or your family becomes verbally abusive or aggressive, I will keep you alive, and I won't do anything nice or extra for you. I'm not neglectful, but I certainly won't want to go in your room any more than necessary. Also, sometimes I would love to just be honest with some family members who are aggressive and just be like, listen, we're on the same team here. You want them to get better. I want them to get better too. I spent lots of money in 4 years of my life to even get licensed to do this. I want to take care of your loved ones and make sure they go home with the best quality of life. Please, stop fighting me and the rest of the medical team like we're on opposite sides of this issue. We all want the same thing, damn it. I think, again, this goes to the comparison of equating nurses with retail store workers or fast food employees or some other customer-facing job. Their skill set and what they're dealing with is going to be a little bit different, and trying to bully them is not going to result in better service. I don't think these people getting bullied are going to result in better service no matter what kind of customer-facing job you're working.
Please like and subscribe if you made it this far. I hope you'll enjoy the rest of the video and have a wonderful day.
Story 7. A lot of the time, I think the doctor taking care of you, or another nurse, or the PA, is absolute trash. They don't know what they're doing, they have bad outcomes, and they're too arrogant to work on fixing what needs to be fixed. Some of them are distracted because they're having affairs with multiple coworkers. Some of them are alcoholics or are abusing prescription medications while at work. But I can't say that to patients. In fact, a few years ago, the hospital instituted a new policy requiring nurses and other staff to say positive things about their patients' other caregivers. So I will find something relatively honest and seemingly reassuring to say to patients, which improves satisfaction scores and reimbursement. But it's just short of a lie about half the time. Story 8. Male ER ICU nurse here. I'd say overall, women are more vulgar than us guys, openly talking about spicy time, periods like it's a normal conversation. We laugh at patients and other staff all the time. From genitalia, overall body appearance, and smell, ER staff have a bad reputation for sleeping around. Think of all the police and firefighters that come in. The ER staff is generally hated because we send patients. Yes, some stuff might be undone, nor do we know everything about the patient. They don't understand or care that we can't turn away patients. So when the ER is full and sick patients come in, we start taking care of people in the hallways. Story 9. Patient falls are a huge issue in hospitals. Insurance and the government doesn't reimburse hospitals for any injury or increased length of stay due to a fall. The hospital simply eats the cost. So, when you fall, we get in trouble. Lots of paperwork, meeting with our manager. Hell, we can get written up or fired if it's a frequent occurrence. I work on a neurosurgery unit which has a high risk for falls because our patients have either had strokes or brain surgery and are confused or impulsive, or had spinal surgery and are on high doses of narcotics. I've had 3 patients fall in my nursing career, and all 3 times, my initial response wasn't, "I hope they didn't get hurt." It was, "Are you fracking kidding me? Frack, now I'm gonna get in trouble." Story 10. If you're expiring because I hurt so bad and tell me your pain level is at a 10, yet you're on the phone laughing at someone on Facebook, yeah, I'm not too sympathetic. You'll get your pain meds, but it's gonna be a few extra minutes. And if I've got someone on the floor because their blood sugar dropped in the 30s, you're gonna wait a little longer. And don't even think about giving me a lecture on how to do my job. I am your nurse. I'm here to take care of your butt, not to kiss it. I'm not your slave. I'm not your personal servant. I'm sure as hell not your maid. And don't tell me how your kid or your mom or your sister or best friend is a nurse and they do things differently. I do my job the way I was trained to do it. I've got 35 to 40 residents on any given night. It's just me. I love my job, and I love my residents, but damn it, sometimes I want to scream. Story 11. Not a dirty secret, but damn, you really should be aware that when you're a tool to us, your doctor is aware. I've worked for doctors who would fire a patient from the clinic for being offensive to the nursing staff or front desk staff. We recently had a patient arrested for making threats to our operators, threatened to come down and chop their heads off. Story 12. You need to let your 87-year-old grandma pass away. She is 110 pounds and just went through a 3rd round of chemo. Her quality of life is a 1, and until you sign a DNR, we're going to resuscitate her when she codes, breaking about 10 ribs in the process. She can't legally make decisions because of her dementia, but she's ready to end the pain and pass. Passing away is the natural end. Straighten out her affairs, say your goodbyes, and pull the plug. Story 13. Not really a dirty secret, But when you're naked in front of medical personnel, we don't care that you're naked. And literally 4 seconds after you're clothed or no longer in our presence, whichever happens first, we've forgotten what you look like naked. You only remember what people look like naked because you've seen a small number of naked people. We see naked people all the time. And yeah, whatever. That's a penis. Those are boobs. Oh look, an anus. Stretch marks, fat folds, whatever. Story 14. I'm a male veterinary nurse. The amount of punches I have nearly thrown due to being told, "Why are you a nurse? You're a man," or "Why aren't you a vet?" or "You're just a nurse," etc. But it's fine. Carry on and undermine me. I'll just be here with a smeg-eating grin as I charge you extortionate amounts for pharmaceuticals to treat your dog's stupid ailments that could easily have been prevented had you not fed it fried toast and sausages from the dinner table. Story 15. This is a recent one. Some days, for me, it's when I'm sick. We can only call out 2 times in 6 months. I don't feel like taking care of you, and I would rather sit at the nurse's station and not do nothing, but I know that you need me. Knowing that you need me is the only thing that brings me to your room to answer your call bell for the millionth time. Story 16. I would much rather be doing the dressing changes and bathing my incapacitated sweet patient next door than getting you coffee and your 6th ice cream of the morning, you non-compliant smeg face. Things I've dreamed of telling people, most recently being yesterday. Story 17. Hospitals are dangerous. Ask questions. Have someone with you that isn't afraid to ask questions if you won't ask them or can't ask them yourself. Every day, people expire in hospitals due to errors. The equivalent of an airplane full of people expiring every day in hospitals due to preventable errors. I'm a nurse, and I also have an ill spouse. I've seen both sides, the good and the bad. Hospital errors are the 3rd leading cause of terminations in America. Story 18. Dear all fed-up nurses in this thread, I'm sorry for crying and calling you guys at 2 a.m. to get the blood out of my nose. And I'm especially sorry to the new nurse that I puked blood on 3 times. Also, special thank you to the nurse that was passing by me getting my blood done and stopped to hold my hand through it. You guys are great. Story 19. Senior nurse. I don't really care anymore. I will help you as much as I can, but if you don't want help, then go home. I don't care enough to persuade you to accept treatment. Free up the bed for someone who wants to be helped. One day, I am going to say, look, I don't care if you live or expire. I get paid whatever. If you don't want help, go away and let someone else have your bed. I know when I say it, I will get in so much trouble. Story 20. Not a nurse, but everyone in my social circle either is or their significant other is. How often doctors make mistakes. They send for a medication, and the nurse gets it and realizes something is off, or the medication is completely not what the patient should be getting, and they have to contact the idiot doctor to get a correct script. Story 21. From the husband of a nurse. They mess up, and if at all possible, if nothing bad happens, they hide it. And smeggy patients get the bare minimum won't get me written up care. Story 22. I worked as a director of nursing and also as a nursing care manager. Patients are often looked at as nothing more than currency in the world of healthcare administration. Patients are regularly discharged from hospitals prematurely due to concerns of the cost of care. Story 23. My wife's a nurse. During the night shift, she'd talk about other nurses going and finding empty rooms and taking extended naps in shifts. It irked her, since she has a solid work ethic, but she isn't the kind to speak up. Story 24. Some nurses making fun of small or big penises. I had an older gentleman who tried to pee in the bedside urinal, but the urine would just flow down onto the bed instead of the urinal because his penis was too small to reach the mouth of the urinal. Story 25. Not to paint every nurse with the same brush because I've met some absolutely fantastic nurses, but a good chunk are untrusting and hostile towards the lab. We're all here for patient care. The amount of disrespect I get at times is very demoralizing. Story 26. Not a nurse, but I do work in a hospital. I've seen a nurse passing out photos she took of her own Achilles tendon surgery to her coworkers like they were Pokemon cards. Story 27. I was in the hospital for 3 days of rotating nurses, and all I can say is that you are at the mercy of that person. Everyone is very, very different in terms of attitude and service. It's like Russian roulette. Story 28. Not a nurse, but a security officer in a hospital. Sweet Jesus, are nurses perverted and freaky? I swear it's an act of God I don't bust a zipper from them talking about their intimate escapades. Story 29. Your baby is not cute. It looks like a skinned rabbit. And no, that's not such a great name. It is either awful or the 10th baby with that name this week. Story 30. I have strep throat, but I'll get written up if I call in more than 3 days in a row. Sorry about your grandma and her suppressed immune system. Story 31. We never believe how much alcohol you tell us you drink. Whatever amount you say, we double that and report to each other the suspected amount. Story 32. Alzheimer's patients never sleep and are sneakier than a 5-year-old trying to get a look at Santa on Christmas Eve. Story 33. If I have to fart, I go into the rooms of demented incontinent people to do it. They're farting up the room anyway, so it's all good. Story 34. That it's no longer patient-orientated, but profit-driven.
Please leave your story in the comments. I would love to make a video on them in the future. Also, don't forget to like and subscribe.